Hi everyone, today we're going to be talking about menopause and risk of asthma. Asthma is a chronic condition where the airways in the lungs become overly sensitive, leading to inflammation and narrowing that restricts airflow. The inflammation also leads to mucus buildup and muscle tightening around the airways, further blocking airflow. This makes it harder for people with asthma to breathe normally without treatment and management strategies to control symptoms. Currently, around 300 million people worldwide are living with asthma. The main symptoms of asthma include wheezing, coughing, especially at night, shortness of breath, and chest tightness. People may experience one or more of these symptoms, which can come and go and usually improve when triggers are removed or medications are taken. Symptoms may worsen at night or be triggered by exercise, cold air, or allergens, which can indicate asthma. Asthma has several treatment options. One example is quick relief inhalers, which are used to provide immediate relief during an asthma attack by relaxing the muscles around the airways. Another treatment option is long-term control inhalers. These are taken daily to reduce inflammation in the airways, helping to prevent asthma symptoms and reduce the frequency of attacks. Another treatment option is combination inhalers. These contain both quick relief and long-term medications for patients with more persistent symptoms. And another example of a treatment for asthma is oral medications. For more severe cases, additional pills or injections may be used to reduce inflammation or address immune responses that can also trigger asthma.
Now we'll move on to what is menopause. Menopause is simply defined as the permanent end of menstrual periods and thus the inability to become pregnant. In order for menopause to be confirmed, you must not have your menstrual period for 1 full year, meaning that 12 months have to pass from your last menstrual period. Additionally, sometimes healthcare professionals may use the term menopause when referring to the transitional period when hormone levels start to change, known as perimenopause. I also wanted to quickly define 2 additional terms that are used alongside the word menopause to perhaps clarify any confusion, which is something I definitely had. First is premenopause. This is simply the time between your first menstrual period and the first symptoms of perimenopause or menopause. Throughout these years, you are having periods and are seen as in your reproductive years. Additionally, on the slide is shown an arrow kind of drawing out the relationship between premenopause, perimenopause, and menopause. Next is perimenopause. Perimenopause is defined as the transitional period between your first irregular period until menopause, which is when it has been a year since your last menstrual period. This period of time can last on average for 5 years, starting around your mid to late 40s. Due to the ovaries gradually producing irregular and in most cases less amounts of progesterone and estrogen, you may experience a multitude of symptoms such as night sweats, hot flashes, irregular periods, loss of bladder control, changes in mood, vaginal dryness, and many more. The last term is menopause, again. So once again, it is when it has been 12 months since your last menstrual period. And in 2023, in Canada, the average age of menopause was 51 years of age. Now that we know what menopause is, we can look at what causes menopause. To begin, there are different types of menopause. First is surgical menopause. This is the onset of menopause due to surgery such as having one or both ovaries removed, also known as an oophorectomy, or having radiation in the pelvic area where the ovaries are located. The second type of menopause is a premature menopause, where you have ovarian failure before the age of 40 due to the ovaries failing to work or not working properly. Reasons for this may be due to chemotherapeutic drugs, impaired blood supply to ovaries that may happen during surgery, smoking, or radiation exposure. Lastly is the natural menopause that occurs with aging, and which we will talk more about on the next slide. Overall, the cause of natural menopause is due to age. More specifically, however, it is due to the number of oocytes, the eggs that are released from the ovaries each month, reaching a severely low level and ultimately ending ovarian follicular activity, which is that production of releasing an egg. This results in changes in hormones that regulate the menstrual cycle, leading to irregular periods that are facilitated without ovulation occurring until your last menstrual cycle. This further results in a decrease in sex hormones, such as estrogen, which is responsible for hot flashes as it plays a role in thermoregulation, and an increase in bladder urgency and frequency, vaginal dryness, and urinary tract infections, as estrogen maintains the tissues of the vagina and keeps pelvic floor muscles elastic.
So now that we've talked a bit about what menopause is, we can get into the hormones involved, particularly estrogen. So what is estrogen? Estrogen is a hormone associated with the female reproductive organs and is responsible for female sexual characteristics. During the reproductive years, which is between puberty and menopause, estrogen fluctuates with the menstrual cycle, where it's at its highest just before ovulation and stays within a normal range. Estrogen is at its peak during one's late 20s. Then, during menopause, which on average begins in the early 50s, estrogen levels plummet. We can see this pattern in the graph here, which shows how estrogen fluctuates with age and drops significantly during the menopausal age at around 50. With all the symptoms that come with menopause, including hot flashes, vaginal dryness, anxiety, etc., HRT is a common treatment. It works by replenishing the hormones that are low during menopause. It can be taken as an estrogen only, or more commonly, estrogen and progesterone combined. And HRT can come in a variety of forms, including tablets, gel, patches, or a vaginal ring. So to tie this back to the topic of the video, how does HRT impact asthma? So all hormonal transitions affect asthma: menstruation, pregnancy, menopause, etc., suggesting a correlation between hormone levels and asthma severity. Estrogen has a widespread effect, including on the airways. HRT is associated with an increase in asthma prevalence, incidence, and hospital admission related to asthma. One study showed that women being actively treated with HRT have a 63% increased risk of new asthma development, further suggesting a link between HRT and asthma.
As we can see, estrogen is a key hormone in the body. It has significant influence on the immune system. One way it does this is by promoting the production of type 2 helper T cell cytokines, a type of signaling protein involved in immune responses. Estrogen binds to specific estrogen receptors known as ER-alpha and ER-beta receptors, which are found on various immune cells, including T cells. Once estrogen binds to these receptors, they act as transcription factors, which are proteins that help control the expression of certain genes. When estrogen binds to its receptors on T cells, it activates specific signaling pathways that drive gene transcription. This process upregulates genes that are responsible for producing Th2 cytokines, including interleukin-4 and interleukin-10. The increased levels of these cytokines further promote the Th2 immune response. When Th2 cells encounter allergens, they set off a chain of immune responses, including the activation of mast cells. These mast cells release histamines and other mediators, which cause immediate asthma symptoms. Histamine release leads to bronchoconstriction, which is the tightening of airways, along with increased mucus secretion and swelling. Together, these effects narrow the airways, causing the characteristic wheezing, coughing, and shortness of breath often seen in asthma.
In conclusion, menopause is a natural biological process, often accompanied by reduced estrogen levels and significant physical changes. Asthma is a chronic condition affecting millions worldwide and can worsen with hormonal fluctuations, including menopause. While hormone replacement therapy can alleviate menopause symptoms, it is linked to an increased risk of asthma development and hospitalizations. Thank you for watching, and make sure to watch more videos like this linked below. More resources are also in the description.